Welcome and thanks for joining us. My guest today is Dr. Kathy Spangler. She's Senior Healthcare Consultant at Maximus. Good to have you with us.
Thank you. Glad to be here.
And as healthcare delivery becomes more digitally based, and telemedicine and the electronic tools, and you guys are at the forefront of that delivery, we still have veterans of World War II alive, and Korea and Vietnam. So how do you kind of balance the drive for the efficiencies and health benefits of digital against the need for the less technical savvy to be able to access healthcare?
Well, ultimately, it's trying to make sure that wherever that patient is, understanding them at their level. Because I got to tell you, I've got 22-year-olds who are not, believe it or not, are not technologically enabled and can do things. So it's being able to be able to show them, bring in the resource to say, let me show you how to work your phone. Or some of my folks, we've got some remote health monitoring devices. Let me show you how to use that. And it's just that old school, just teach, see one, do one, teach one. But it's also being available to them. So it could be frustrating if you've got something new electronically that's out there and nobody knows how to use it. So we have to be available to our customers, to those patients, to make sure that they know how to use it. And then they've got to have some quick wins. I always find that if I have a patient that's able to, something as simple as doing an appointment on the phone, because that's technology, right? Doing an appointment on the phone, and once they do, they're like, oh, I did it. And yeah. So then it's like baby steps. And then you go to the next step. Okay, next time, we're going to show you, you're going to wear this device, whatever device X is, and it's going to monitor your sleep. And guess what? When you come into the doctor's going to have real-time data just to look at that. And so they'll see how they're part of that, making it part of their patient journey. So I think that's the key, is making that patient, having that self-centered, enabling them to understand exactly what it means to come in and to get healthcare delivery. It doesn't have to be old school walking into a doctor's office or your provider. It's letting them see the so what of how this can help them.
Sure, and it probably gets down to even the basics of app design.
1000%.
You can have a big button or you can have a bunch of little tiny buttons, that kind of thing, just to help people be enabled to get what they need to get done without a lot of...
And a lot of companies like DHA, even Maximus, we have folks along the way to help them. We have folks who are technology capable. Their full-time job is to help teach you how to use that X, whatever that technology may be. And so that's making sure you have the right people part of your team. So this next age, working with AI, we want to make sure those folks can speak the language and translate it simplistically to no matter what age, level, or wherever you may be with your technology capability.
And that's just simply the access or the front door to all of this, but the actual needs and requirements of people do change also from, when they are young, when they're active duty, when they're maybe later on in active duty life, and then when they become a veteran, and then when they become an older veteran, the actual care you need typically changes. And so how does the digital keep adapting for that life cycle stage that the individuals are in?
Sure. There are so many really neat devices out there now. I mentioned remote health monitoring. So if I wanted to see what your sugar level was, and instead of coming in doing a blood test, we actually have devices that can monitor your blood sugar at all times. And what's great about that, it automatically gets downloaded into your electronic health record. So when you go to see your physician, or if your physician just wants to check on you and you have a video call with him or her, you can say, hey doc, I've been looking at my sugar, and the doc goes, hey, your sugar's been really high. How do you know that? Because you have that remote health monitoring device. How cool is now, you don't have to come in and get these blood tests. You don't have to go through the snowstorm. You don't have to go, you now have those kind of capabilities. Or next step, I want to monitor your sleep. I know there's lots of cool gadgets out there. A lot of companies are doing the watches and all, your phone and all that, but there's even more advanced technology out there that healthcare providers are using to help monitor your sleep. How this relates to readiness, I'm going to throw it in there, is, if I have a lot of sailors on a ship and in this 24-hour operations, as a leader, our sailors we can monitor their sleep habits to make sure that they're ready, they're getting that proper sleep hygiene, because we want to make sure they're ready for the next whatever. So it's just a good holistic approach to the patient, but it's a matter of how we take it to our patient and how we get him or her to adopt it.
And those devices that do all of this monitoring and a million other parameters, these nowadays are not invasive or difficult
Correct.
Devices. There's no needles in people or anything.
Could just be of wearing like on your finger, on your arm, around your waist. I mean, there's all kinds of different stuff that we're using now. It just depends on what the need is or what we need to look at. And the comfort, patients now have choices. They can decide, do they want to wear a device on their finger, or do they want to wear a device on their arm? That's what's so great is we're evolving. Healthcare is evolving, and we're coming to that digital age.
And how do you approach the issue of interoperability of those devices? Because
Sure.
there's this brand and there's that brand, and if you look at the rings, there's like 10 different brands of rings and so on, and it all has to come into...
Someone has to bring it all together in
Yeah.
concert, right? So I think that companies that I work for, Maximus, we're a leader in the federal healthcare solutions, and we are helping enable these innovations through technology integration and also through that process optimization using that human-centered approach. We want to make sure that patient's at the center of what we do, so we bring it all together. So working with companies like Maximus, that's how I know DHA, the VA, they're trying to, again, making sure that patient gets the care they need where they need it. Instead of them coming to us, we're going to help come to them. And so that interoperability, that's a key. There's a lot of things out there to help sync it all together, but it's got to be done securely and safely.
And what's the latest in the data gathering technique for this? So someone is being monitored remotely, or as you say, people like to monitor themselves and just look at the app and see how they did in the last 24 hours. Is this something that is continuously feeding back to, say, the DHA or to the VA medical center, or is it a download when you log in type of thing?
So it just depends on the device that you're using. Right now for DHA, we have that one electronic health record. That was a huge accomplishment back in March of 2024, where 100% for DHA has one electronic health record, MHS Genesis, and that is going to sync with other devices that will be able to push and pull that data, that bi-directional pull. So that's the key. Specifics, I mean, there's many, but I think the key is making sure that we're talking to all of our different partners, whether that's the VA, whether that's DHA, or companies like Maximus. How do we help bring that concert together? I like that analogy of we want this to all work and beautifully, but also we want to make sure it's good for the patient, but it's also good for the person who's delivering that modality.
Sure, and there can be some real benefits in real time, because some things you just need to look at the last month's trend.
That's right.
But sometimes if they're monitored for, I don't know, defibrillation of
Yeah.
the heart,
Yeah.
or excessive blood sugar, which could actually threaten a person in the moment, then it's possible to
And
for
a
an
lot
alert.
so a lot of these devices actually call 911 for you. So a lot of these devices that are that we're using, if we're really scared, it'll do like a matrix where it's kind of doing an algorithm. Again, this is a lot of AI-enabled technology where, okay, Kathy's blood sugar is 20. 20 is bad, by the way, if you didn't know that. We're going to call, she probably is passed out by now, but we're going to call 911, and it's going to, emergency services is going to come to wherever he or she is. So that's the goodness of technology.
And you're finding acceptance of this among the patients and the beneficiaries themselves, because I imagine the providers love it.
Yes. So full disclosure, it's hard, right? Change is hard, but we have to be able to showcase to our patients, we have to be able to showcase to our providers the goodness of this. It is, I think, for example, my husband, matter of fact, he needed to see his provider, and I said, well, did you get on the app and go make an appointment? He goes, I don't know how to do that. I'm like, are you kidding me? Here I am talking about it. I'm like, let me help you. Here, honey, sign in. Oh, wait, it's face enabled. You've got to sign in. And it's literally click of a button. And, oh, I didn't know I could do that. He just didn't know. Also, it doesn't help. And we've got to make that patient or that person feel comfortable. Obviously, as his wife, I have a little bit of extra candor with that. But ultimately, when we have patients come in or just want to figure out how to access the system, this is supposed to help. And it's supposed to make it easier. Sometimes that first time is a little hard because it's new. But I think once we start using it over and over, they see the ease, they see the cost savings, and they see that they can get in and see their provider or get answers sooner than they had in the past.
And the data so gathered, does this also go into the Genesis EHR that both
That's the
departments
key.
operate?
Correct, the key.
And also to the Maximus exam readiness system too that
Yes.
goes alongside that.
Yes, so both will go into both. It'll be bi-directional, where whether or not Maximus is getting that information, it'll then get funneled into MHS Genesis. So then again, that provider has that real-time data, so we know exactly what's going on with the patient anywhere they are in the world.
And if that provider's off duty, but there's one in Seattle instead of Philadelphia,
Yes.
they would have the same information available,
You are
and they may not
correct.
know the person personally, but they know what they need to know to render help.
As long as, yep, as a provider, if they needed to render help, they could get into the system. Obviously, it's a secured system, but of course, anybody around the world that is able to have access to the system could help that patient.
Wow. So then, how do you make sure, though, that what's the up-to-date keeping method of all this? Because this technology changes so much.
So I'm not the technology expert, but what I can tell you is it's constantly being monitored. That cybersecurity risk, the technology experts that we hire within the company or that DHA utilizes, I mean, that is their full-time job. They need to make sure that the system stays integrated, that it stays up to date for any security prioritization. We don't want anybody getting in. I think some of the biggest risks people worry about is what if someone gets into my record or gets into my information. Their job, and they do a great job of it, is to make sure that doesn't happen.
Or they could, play man in the middle and give the wrong data
Correct.
associated with an individual. That would be equally disruptive, I would
Very
think.
equally disruptive. You're correct. Yes.
All right, on that note, we're going to take a short break. My guest today is Dr. Kathy Spangler. She's a senior healthcare consultant at Maximus. I'm Federal Drive host Tom Temin on Federal Insights, sponsored by Maximus here on Federal News Network. Welcome back to Federal Insights, sponsored by Maximus here on Federal News Network. My guest today is Dr. Kathy Spangler. She's a senior healthcare consultant at Maximus. I'm Federal Drive host Tom Temin, and your host for this discussion. And I want to talk about you for a minute because you are a senior health consultant. You're also a long-serving, decades Army nurse. And I think your own experience might be interesting in terms of what you've seen and how this technology has gradually come into what you do and some of the benefits you saw from technology.
Sure. So 28 plus years, been very grateful to serve our nation and as an Army nurse. And I have been to the point of injury with patients in Afghanistan, and to the point of, taking care of patients, Walter Reed, to ending my career in the executive level of running hospitals. So it's been really awesome. And then overseas, being there during COVID and running hospitals. So I will tell you, when I came in, we called them green sheets. It was still pencil paper, which I would have thought almost 30 years ago we would have already advanced to technology. We were just starting to get computers slowly. And who would have known that within 25 years I would have had an electronic health record where I would be, using a scanner to find out the patient's name, date of birth, everything, also talking to them, and then all of their medical records comes up in one click of a button. Wow, that has been a game changer. And I look back at Afghanistan, if we would have had some of the AI capable technology that we have now, if I would have had it 10 to 15 years ago, although our save rate was pretty high, still, if you made it to us, you're 98% going to survive. However, could you imagine directly on the battlefield those soldiers, sailor, airmen, Marines, if they would have had some of the things that we have now? So what I can tell you is it's evolved. We are evolving. We're in that digital transformation stage. And DHA and the VA are hanging on, and they're trying to make sure that warfighter, that veteran, that they and their families and beneficiaries, they get the care they deserve and they need. And it's pretty awesome. And now to be on this side and to be with Maximus and to be able to see how we can have our technical capabilities enhance it, how cool is that?
Yeah, it seems like the technology adoption is accelerating. We heard about the e-dog tag back in the early 1990s, back when the green sheets were there, as you mentioned, in pencil and paper. But now, do they have an e-dog tag, by the way?
To be honest, I don't know about an e-dog tag. I know that we have a lot of really cool tools and gadgets that we're using. And, if you look, at the prolonged field care, because we think we're going to be, on the battlefield, there's a lot of really cool gadgets out there. Like you're talking those cool sci-fi helmets that a medic or a corpsman is able to look at the patient, and there's a doc, thousands of miles away being like, yep, you're assessing the patient, and this is what's going on. You have a broken arm. They're there to help enable that health care, because we can't have docs everywhere in the world at every point of injury. But we have a lot of really amazing men and women serving that are going to be there. So that technology's been amazing.
Yeah, so the delivery of medicine in the military context then is something less and less serial, step by step, and more integrated in real time, it sounds like.
Yes, and just for AI, what AI is doing for us, it's enabling us, but it's help facilitating that care. AI doesn't take the place of that human-centered design. It doesn't take the place of that patient or that provider who went to school to provide that care. It's just helping facilitate it at a faster pace, and that's what's really exciting about it. So now, as a provider, or our nurses, our docs, our medics, they're able to provide that care quickly, efficiently, and then feel comfortable and go to the next whatever that is. And then they get, if in the hospital setting, they're getting time back for themselves. They're able to really take care of themselves and maybe do those things instead of like patient. It's okay, I've got a patient, but man, using technology, I'm able to see that patient in a more efficient manner and make sure it's in their medical record in a quality, safe way. And then I'm going to do those things, that helps fill their bucket. Because burnout, it's a real thing too. So there's the pros. There's a lot of great pros with our technology.
And let's talk about the idea of remote medicine. Yeah. This is happening, virtual medicine, and relate that back to us for us to medical readiness.
Sure.
And troop readiness and so on.
So you've got troops all over the world. We just don't have enough medical capability to be with every troop, and I say troop broadly, Army, Navy, Marines, Coast Guard, you name it. We don't have enough capability to have medical everywhere. Space, you're right, space, I apologize, Space Force. But we do have a lot of really smart people all over the world, so you're basically dialing in, whether we can call it remote health monitoring, we put it in one big bucket. It doesn't have to be they're wearing the gadget, but it could just be I have a capability, whether it's through satellite, for me to talk to a doc, a nurse, a medic, or for me to just have that conversation, or to do that video consultation. That's where we're at right now. And my one of my peers, we talked about delivering blood to the battlefield through a drone. I mean, we've got so many neat things that we're doing now that we're able to get you what you need all over the world, that anytime, anywhere, any place.
And what are the learnings that can maybe apply from DHA context to VA and maybe vice versa?
The learnings. So,
well, it sounds like there's a lot of medical records being generated, a lot of outcome generated, and it seems like that could inform everybody's.
Yeah, so a lot of lessons learned, but ultimately by having your electronic health record in one place and being able to integrate with each other. So the goal is for DHA and VA, their one medical record to be able to see it. We're not there yet, but there is a goal, and it's going to happen. I know, it's going to happen sooner than later, but we want to be able to have a place where our medical information is put in one place that anybody can access anywhere, but it's quality, safe information that the patient can take with them, whether it's with their phone, their watch, or whatever gadget they want to use. Hopefully that answered
Yeah,
the
it does. And it also implies that the record is really something that belongs to the patient in some sense, as opposed to military or VA paperwork or something they had. You could apply to get your information on you. But in this case, both the individual and the organization can utilize it.
Oh, and the patient has input. You're right. It makes them, like, I now don't have to wait or hope to ask for my medical. What happened to that appointment I just had? Matter of fact, I just left an appointment. They said, would you like a printout of that? I'm like, oh, it's on my app. They're like, great. So it gives that patient back that control and makes them feel like they're part of that journey instead of it just being one way.
All right. And, well, I guess with all the technology we've talked about, and we touched on this a little bit in the first half, what do you do as a company in enabling all these technologies to make sure that they have shelf life as new technology comes in? Because just for example, the things that can be sensed externally in the body seem to increase all the time. So we at Maximus, again, I mentioned it earlier, but it's just being ahead, it's evolving and being part of that innovation. So we have a lot of, there's different versions, but technical capabilities that's really helping maximize, see, I used it in there, it's maximizing that patient's overall health, their potential. And so we've been doing this. Maximus has been around for 50 years, and I think we're actually been ahead of the ball game. And so our goal is to, again, use all of these resources to help agencies like DHA and Veterans Affairs to make their patient experience the best. And why not do that by enabling technology? And when you talk to the providers, what is it they're telling you that they need help with? What are their so-called pain points? Yeah, they want to be able to utilize whatever technology. They want it to be simple. They don't want to have to click 25 buttons. They want to be able to walk in, have a conversation with the patient, find out what's going on, spend time with the patient instead of it being behind a computer screen.
and all they're doing is looking at the computer screen instead of looking at the patient. Now we have capability where we can walk into a room. Hey, I'm going to record this conversation with your permission, but I'm also, I've got other technical capabilities, and I just want to know what's going on with you today. Tom, how can I help you? And that way you feel like you're being heard as a patient, and then the provider also is capturing everything. And then, oh, by the way, with AI, it's allowing us to look at those algorithms like, hey, doc, it looks like Tom might have this be going on with him, but it's ultimately the doctor who's making that decision. AI is just helping facilitate that care.
And I would think with all of the remote monitoring and all of the data gathering that goes on and could be continuous with a person, it would make not so much the diagnosis, but the treatment and the dealing with the patient itself much more efficient, in the sense that everything leading up to this moment is already known.
Correct.
And the appointment doesn't become an exploratory mission.
Correct. So that means you're spot on. So all that information that we've talked about, the provider at a touch of a button can review it ahead of time. It's not no more going through old records or trying to figure out the piece, spending 20 minutes to figure out your history. And also, what's great about this is giving us predictive analytics. So we're able to take all this data, and we're able to look based off what's been going on with your heart rate, your blood pressure, whatever diagnostic thing is going on. We're able to take that and be like, you know what, Tom? Based off everything I'm seeing, I know we say that you might be at risk for, I'm sorry, I'm going to say heart attack, but here's what's going on in the last 30 days, and we're seeing this because we're able to monitor, your oxygen level or monitor your temperature, your heart rate. And so let's talk about that. So those are the bonuses of when you are able to put it all together and have one place to look at it.
And I think, telemedicine came in big for the country and for people when we had the pandemic.
Correct.
And so therefore the delivery is nothing like what people imagined 10 years earlier. So just putting on your predictive hat, where do you think this is all going in the next generation of medical care delivery and record keeping and patient-centeredness?
I think it's going to continue to evolve. I really hope that there's not another huge pandemic that makes us evolve even faster. But I think that as a healthcare agency, whether that is DHA or the VA or our civilian teammates, we got to work together. We're integrating AI at a fast pace, but it's making sure that it's safe, that it's reliable, that we've put in the safeguards to ensure that the patient still feels like they're part of that journey. And so I do think it'll evolve even more. Like if I had to predict and put my 20-year hat on, for our Star Trek guys and gals or whoever's out there, it could be something more where you're just I'm thinking my thoughts to you, and here's what's going on. I do see it evolving more and more, especially as we explore out in space and all those other fun places.
We'll call it M3, medical mind meld.
I'll let you be the one to keep that one. Okay, I'm going back to Maximus. M3 came from you.
No charge.
No
hey,
charge.
Great having you in
Thank
to
you.
speak with us today. My guest has been Dr. Kathy Spangler, a senior healthcare consultant at Maximus. I'm Federal Drive host Tom Temin. You're listening to Federal News Network. For more on this discussion, please visit federalnewsnetwork.com and search Maximus.